Good afternoon. I apologize for being late to open this important meeting. I have a last-minute urgency. Fortunately, I'm here. Let me express my welcome to all of you, distinguished panelists, excellencies, colleagues, friends. The mission of Colombia to the United Nations Office and other international organizations in Geneva is honored to participate in this timely and vital discussion. We express our deep appreciation to the co-sponsors of this event, the permanent missions of Portugal, Switzerland, the Czech Republic, South Africa, Uruguay, and Thailand, for their steadfast commitment to advancing a human rights-based approach to drug policy. We also extend our sincere thanks to the Office of the High Commissioner for Human Rights, the World Health Organization, and the International Drug Policy Consortium for the leadership and support. Equally, we are grateful for the vital contributions of civil society, whose sponsorship and advocacy have been indispensable in shaping this dialogue. We acknowledge the commitment of the following organizations: the Global Commission on Drug Policy, African Network of People Who Use Drugs, Médecins du Monde, Law Enforcement Action Partnership, Harm Reduction International Network of People Who Use Drugs, Canadian Drug Policy Coalition, Transform Drug Policy Foundation, Youth Rights, UNAIDS, and I mentioned before, International Drug Policy Consortium. Their tireless work, grounded in lived experience and community engagement, has helped to elevate the urgency and legitimacy of drug policy reform efforts across the globe. Colombia, once considered as a champion of the war on drugs, is now undergoing a profound transformation. After decades of suffering the immense human, social, and environmental costs of punitive drug policies, we are charting a new path, one grounded in the recommendations of Colombia's Truth Commission and centered on public health, social inclusion, and human dignity. The final report of our Truth Commission, published in 2022, revealed that the illegal drug economy was not a secondary phenomenon, but a central driver of a prolonged and violent conflict. Drug trafficking financed armed groups, intensified territorial disputes, and inflicted disproportionate harm on rural, indigenous, and Afro-descendant communities. The Commission denounced the devastating effects of the war on drugs, the so-called war on drugs, human rights violations, forced eradication, displacement, militarization, and the stigmatization of vulnerable populations, particularly small-scale farmers, youth, and people who use drugs. It called for a paradigm shift to move from prohibition and repression to policies rooted in care, rights, and development. Colombia has embraced this call. Our government has adopted a new national drug policy for 2023-2033 titled "By Sowing Life, We Banish Drug Trafficking." This policy was developed to an inclusive national dialogue involving victims, farmers, ethnic communities, youth, and civil society. It is informed by those who, for too long, were silenced and excluded. At the heart of this policy is the recognition that drug use is not a crime, but a matter of care and public health. We are implementing an approach based on evidence, treatment, and harm reduction, not punishment. Our goal is to save lives, reduce risks, and build inclusion with dignity. Harm reduction is central to this effort. We are expanding access to health services, fighting stigma, and preventing overdoses. We aim to reduce the physical, mental, and social harms of problematic drug use, especially among marginalized populations in both urban and rural areas. We also recognize the historical debt out to communities that depended on the illicit drug economy due to poverty and to state neglect. These communities have borne the highest costs in lives lost, ecosystems destroyed, and rights denied. Our policy responds by promoting rural development, environmental restoration, land access, and sustainable legal livelihoods. At the same time, Colombia continues to combat the strategic and high-value nodes, the strategic and high-value nodes of drug trafficking, those who profit the most and fuel organized violence. However, our focus has shifted away from punishing the weakest links, subsisting growers or youth couriers, toward dismantling criminal structures in full respect of human rights and international law. Civil society played a vital role in shaping this policy. The voices of the most impacted, farmers, indigenous, and Afro-Colombian peoples, women, youth, and people who use drugs, were not only heard, but reflected in the policy's foundations. Their knowledge and resilience are the cornerstone of its legitimacy. We also express our sincere appreciation to the United Nations agencies whose technical assistance was instrumental, including WHO, UNODC, and OHCHR, in aligning our policy with human rights and public health standards. A gender perspective is also fully integrated. The policy addresses the specific challenges faced by women and LGBTQI plus people, from criminalization and economic vulnerability to institutional and gender-based violence. It supports gender-sensitive prevention, treatment, and harm reduction, while promoting the autonomy and rights of women in territories affected by drug economies. International cooperation is essential. Colombia's transformation cannot succeed in isolation. The global drug control regime has long imposed punitive frameworks that contributed to violence and inequality. We call on the international community to embrace a new paradigm, one consistent with peace, justice, sustainable development, and human rights. We advocate for a system that prioritizes health, harm reduction, and human rights over punishment, recognizes shared but differentiated responsibilities, particularly for producer countries, supports open, evidence-based dialogue in international forums, ensures access to controlled substances for medical and scientific use, and fosters coherence between drug policy, human rights, peace building, and environmental protection. Colombia welcomes the establishment of the expert panel mandated by the resolution adopted the 14th of March this year, 2025, in Vienna, to review the global drug control regime. This is a unique opportunity to realign international drug policy with contemporary realities and the values enshrined in international law. We stand ready to cooperate with states, UN bodies, civil society, and academia in building this new human-centered vision. We believe that only through multilateralism, courage, and a rights-based approach can we meet the global challenges of drug policy and advance toward a future of peace. Colombia's policy is a call for life, not war, for solidarity, not punishment, for dignity, not stigma. Thank you very much. And now let me give the floor to our first speaker, Dr. Tlalen Mofken, the United Nations Special Rapporteur on the Right to Health, who will deliver a video intervention.
Good afternoon, dear colleagues, and thank you very much for this opportunity to be able to address you today. My name is Dr. Tlalen Mofken, and I'm the current United Nations Special Rapporteur on the right of everyone to the highest attainable standard of physical and mental health. And I'll be sharing with you today some of my own ideas, insights, advice, and of course, some of the research and recommendations that I have done related to harm reduction. I presented a report to the Human Rights Council and the General Assembly in 2024, and both of those reports were addressing harm reduction as we know it, as a concept brought to us by colleagues and advocates and human rights defenders who worked in drug use. But I tried to expand the understanding of harm and the need, therefore, to reduce harm when it comes to the right to health as a public health concept. And so harm reduction builds on the well-established premise that health and human rights are mutually reinforcing frameworks, meaning that a human rights approach can actively contribute to and at the same time benefit from public health tools such as harm reduction. And in the various reports, I explored models of harm reduction as applicable to drug use, HIV exposure, transmission, and non-disclosure, abortion, same-sex relations, and sex work, and that are central to the sustainable peace and development and human rights agenda, spotlighting populations that are often stigmatized, criminalized, and discriminated against to the detriment of their enjoyment of human rights, and particularly their right to health. And so in harm reduction, there is no path to sustainable peace, to development, without the meaningful participation of populations that face historic and ongoing forms of discrimination and marginalization. So preventing and redressing harm are aspirations that have long steered societies and their use of the law, including in the realm of health, where do no harm has been a guiding principle for thousands of years. Harm can present itself in numerous ways. Sometimes it stems from certain behaviors or some substances. Other times it stems not from the behavior or substance themselves, but rather on how states address them or not. And so the social, political, and commercial determinants of health frameworks, with the considerations on substantive equality, can inform the normative content for the underlying determinants of health. In the case of drug use, criminalization presents a barrier to people who use drugs from seeking healthcare, both in accessing medicines and establishing therapeutic relationships and services. We must decriminalize the use, possession, purchase, and cultivation of drugs for personal use, and adopt a comprehensive, a cohesive regulatory framework on drugs that are informed by scientific evidence, considering power asymmetries, pre-existing disparities, and the impact of law and policy in practice. We must implement the full measures of drug harm reduction policies, which of course include needle and syringe programs, drug dependence treatment, HIV testing and counseling, antiretroviral therapy, prevention and treatment of sexually transmitted infections, condom programs, information, education, prevention, treatment, vaccination measures, opioid overdose management with naloxone, including in those situations of crisis, humanitarian and conflict settings, and remove any financial barriers that are related to making these programs sustainable. We must include community care measures for user populations that allow for the reconstruction of social fabrics that are fractured, intersectionality between the systems of oppression. We must make sure that harm reduction as a continuum of care supports individuals as they transition from active addiction to treatment and sustained recovery and social integration. It's very important to fully implement and ensure that harm reduction services are applied widely and are non-discriminatory, evidence-based, trauma-informed, gender and culturally and age appropriate, focusing on the individual and steering away from a one-size-fits-all approach that is often ineffective and often reproduces pre-existing power asymmetries. Campaigning, information giving is important, and the messaging should be robust, easily accessible and relevant, and really clear in terms of harm reduction and public awareness. We must ensure adequate and sustained resources to support evidence-based harm reduction programs. We must ensure sustainable and unconditional funding. And we must, of course, consider reallocating resources that are currently devoted to law enforcement and criminal approaches, and find ways of how to make those resources for public health and right to health outcomes by using equity and enhancing the right to health approaches. And we must, of course, train healthcare personnel to deliver quality services, but to understand human rights, to understand privacy, dignity, and accountability as well. Data is very important. And for as much as we can, we must ensure collection of comprehensive disaggregated data in partnership with the affected communities, because this will also build trust and ensure that health systems are agile enough to be able to take on the generated evidence. And so in closing, in working towards sustainable peace and development, all stakeholders must incorporate human rights and harm reduction approaches through evidence-based, stigma-free legislation, policies, programs, and practices as all of us move to universal health coverage, but making sure that primary health care remains the cornerstone of all public health, and ensure that people who need secondary, tertiary, specialized treatment and support are also able to receive such. And as I've dedicated my entire tenure as the UN Special Rapporteur on the Right to Health to the ideal of the restoration of dignity of all people, it is my hope and wish that the approach to harm reduction that centers the individual not as a criminal, but as a person who's deserving and worthy of their full human rights can be something that we can all support, and realize that the right to health and public health, for example, in particular, will benefit less from criminal punitive approaches and benefit more from human rights standards and approaches. With that, I would like to say thank you very much for this opportunity to address you today.
Thank you very much. Now, let me give the floor to Saved Mahmoud, Human Rights and Drug Policy Advisor, Rule of Law and Democracy section at the Office of the United Nations High Commissioner for Human Rights. You have the floor, Mr. Mahmoud.
Good afternoon. Thank you, Your Excellency, for giving me the floor. Excellencies, distinguished participants, civil society partners, and colleagues, good afternoon. I thank the permanent missions of Colombia, Greece, Mexico, Portugal, Czech Republic, Switzerland, South Africa, Uruguay, and Thailand, as well as International Drug Policy Consortium and other partners to convening this side event. OSHR is pleased to join you. Let me start with a quote from High Commissioner previous statement. And many occasions, actually, he repeated that quote. That is, war on drugs failed. Dear colleagues, not harsh punitive approach, nor war on drugs, but more and more we see that it is human connection, human rights, evidence-based approaches can transform and uplift the lives of people affected by drugs. At the outset of my presentation, let me also emphasize that there is a growing acknowledgement by countries that discussion on drug policy must take into account states' human rights obligation. We have just heard from the ambassador that Colombia's new drug policy, which is based on human rights and putting people at the center. As the High Commissioner recently said, we must build on this momentum. In 2023, OSCHR submitted a report to the Human Rights Council calling for a transformative change in drug policy. It emphasized that drug control policies should be understood as a way achieving broader objective, including the protection of human rights. Excellencies, the overly punitive drug control measures continues to lead to many unnecessary deaths in many countries. 34 countries still retain the death penalty for drug offenses. More than 40% of state execution in recent years were for offenses related to drug offenses. However, some states are taking different path. In 2023, Pakistan abolished the death penalty for drug-related offenses. Malaysia abolished the mandatory use of the death penalty for drug offenses. Just this week, Vietnam abolished the death penalty for crimes of illegal transportation of narcotic substance, along with 7 other crimes. We urge Vietnam and all other retention states to abolish the death penalty for all crimes, including for drug crimes. Excellencies, in many countries, in many contexts, drug situations are also linked with corruption and illicit financial flows. The profit from trafficking in illegal drugs may be used to finance violence, terrorism, and armed conflict. Economics based on illicit trade of drugs are also having a large and growing impact on our climate and environment, from water stress to deforestation and dumping of toxic waste. OSCHR recommend states to decriminalize drug use and take control of the illegal drug market through responsible regulation to eliminate profits from the illegal trafficking, criminality, and violence. Dear colleagues, it is increasingly clear and documented that current drug policy are harming public health. People who use drugs are not getting the help they need. Our colleague from WHO will discuss this aspect. However, I would like to highlight that women are particularly affected. Only 1 in 18 women with drug use disorder is in treatment, compared to 1 in 7 men. Special Rapporteur Right to Health highlighted the importance of the harm reduction. Human Rights Council in 2023 and Commission of Narcotic Drugs in 2024 recognized harm reduction and effective measures to prevent harm, including overdose-related death and other facilities. We must also emphasize the need to address the other social determinant of the right to health. As such, employment, housing, information in addressing the drug problem. In particular, homelessness is both a cause and consequence of drug use and contribute to the poor health among people who use drugs in many countries. Programs that prioritize permanent, stable housing as basis for recovering, in some situations known as the housing first, have proven their value in some countries. In many countries, drug policy have also disproportionately impact on some of the marginalized community. For example, state often over-police indigenous people who cultivate drug as a means for livelihood and for their traditional and cultural use. Many human rights bodies particularly who are addressing the racial equality, such as the independent expert of mechanism on racism and law and enforcement, highlighted the impact of the punitive drug policy on the people of African descent. Our effort to address human rights concern regarding the world drug situation required concerted action by all, primarily by state, but also civil society and United Nations, among others. It is essential to include those most affected by drug use disorder in all decision, policy, and laws. In concluding, let me briefly highlight importance of human rights compliant prevention strategy. Any prevention strategy must include measures to provide accurate and non-judgmental information on drugs to the young people. Primary message of prevention has been one of complete abstinence from drug use. There is not only little evidence of the effectiveness of such a message, but it may be also counterproductive. If there were to be public awareness campaign of youth and drug use, possible way forward would be given accurate, non-judgmental, honest information, prioritizing safety through knowledge while protecting right to privacy. Prevention tools should also include measures to prevent human rights violation in countering drugs. This should include prevention of arbitrary arrest and detention, prevention of torture, and ending impunity for violation. In March this year, UN Subcommittee on Prevention of Torture issued a report on this issue. A few years back, Working Group on Arbitrary Detention issued a study on the prevention of arbitrary detention to drug-related issues. We urge member states to take measures to implement that recommendation. To maintain integrity of any drug control measures, including criminal justice responses, there must be accountability for human rights violation committed in the name of drug control. States should investigate promptly, independently, impartially allege human rights violation or abuses in the context of drug control policy and practices. Our office will continue to do everything in our power to ensure coherence across the United Nations on this issue in line with the UN Common Position on Drugs and international guidelines on human rights and drug policy. Thank you very much.
Thank you. Thank you very much, Saved. And now let me give the floor to Annette Wester, Technical Officer on HIV, drug use, and most of its populations of the World Health Organization. You have the floor, Annette.
Thank you very much, Ambassador. And thank you to Colombia for doing such important work in this area. Excellencies, distinguished ladies and gentlemen, WHO strongly supports this important side event focusing on health and human rights-based approaches to drug policy. At the political level, WHO's latest global health sector strategy on HIV, viral hepatitis, and sexually transmitted infections, which covers for the area 2022-2030, these are grounded in a person-centered and human rights approach and embedded within the principles of universal health coverage. These strategies emphasize the importance of harm reduction, human rights, legal and policy reform, and multi-sectoral partnership as essential to meeting global targets for HIV, viral hepatitis, and STIs. At the technical level, WHO has synthesized the evidence on harm reduction and developed a range of tools and guidelines on this. The first time harm reduction was mentioned in WHO documents that we can trace goes back to the early 1990s. And since then, we have advocated for several decades with countries and at events like these to implement programs and to bring them to scale. The evidence for the effectiveness of harm reduction is clear with the prevention of mortality and morbidity in people who use drugs, and in preventing and managing infectious diseases such as viral hepatitis, in particular hepatitis C and HIV. I know everybody always talks about HIV, but actually the contribution of new infections of hepatitis C is much greater than in HIV when we look at people who use drugs. So, for example, people who inject drugs bear a disproportionate burden of hepatitis C. Injecting drug use is estimated to account for 40% of new infections globally. And harm reduction is therefore a cornerstone of hepatitis elimination efforts, with specific targets addressing both incidence of HCV among people who inject drugs, but also coverage of harm reduction services such as needle and syringe programs. WHO defined harm reduction in our 2022 technical guidelines as the provision of sterile injecting equipment through needle and syringe programs, the provision of opioid agonist maintenance therapy for the treatment of opioid dependence, and community distribution of naloxone to counter and prevent opioid overdose. Just want to say that because of our successful advocacy in the field of harm reduction, it seems that there is sometimes a misunderstanding that opioid agonist maintenance therapies such as methadone programs or buprenorphine are harm reduction services in itself. I just want to stress that actually these are the most effective forms of treatment to treat opioid dependence. So that's their primary goal. The secondary benefit is that it helps people prevent further transmission of infectious diseases. In addition, our guidance reaffirms the importance of integrated, person-centered prevention, testing, treatment, and care, and a set of enabling interventions to address the issue of accessibility of these health services, such as addressing violence, stigma, and discrimination. And since 2014, our guidelines also underscored the value of considering the decriminalization of drug use and possession for personal use. WHO is also a signatory to the UN Joint Common Position on Drug Policy, which promotes a human rights and public health-based approach. We're currently updating both our operational guide for needle and syringe programs to help countries really implement this and to implement quality and a sufficient quantity of programs. And we also update our clinical guidelines for the treatment of opioid dependence and opioid overdose. Just a reflection of our commitment to continuously improve service quality and service access. Finally, we must acknowledge the significant disruptions to evidence-based prevention and care services for HIV and viral hepatitis among people who inject drugs observed since the start of this year. We remain committed to strengthening partnership to ensure these essential life-saving services are expanded to reach more people, not fewer. A technical brief on how to mitigate potential disruptions of services is in development and will be published very soon. Finally, although we have an evidence-based response to drug use, the coverage of the recommended services is too low to have a global health impact. And collaboration with partners such as UNODC, UNAIDS, the Office of the High Commissioner on Human Rights, ministries of health of countries, civil society, and communities of people who use drugs is critical to achieving the targets we set and to improving the access, availability, and quality of harm reduction services. Thank you very much.
Thank you, Annette, for this presentation. Our next speaker is the Regional Coordinator of the African Network of People Who Use Drugs, Mr. Ahmed Said is right. You have the floor, Ahmed.
Thank you, Your Excellency, Ambassador, member state present here, UN family, and the civil society who are present here. Indeed, I'm very honored to be with you to share my experience deeply in a topic that is so personal to me and very important, the key of people who use drugs in driving harm reduction efforts, particularly in the context of Kenya, because in records, I come from Kenya, but I represent the broader reality across Africa. My journey in harm reduction began way long before this title of a regional coordinator, driven by a deep sense of responsibility and empathy for my community. I became the first person in Kenya to distribute needle and syringe to the people who use drugs. That was the year 2012. And today they have a vibrant needle and syringe program plus other harm reduction services like opioid agonist therapy. That was done out of pure passion. I saw the urgent of reduce the spread of HIV and viral hepatitis and other bloodborne viral infection. That experience taught me a lot as a person and as a community, that harm reduction is most effective when it is led by and for people who it serves. And those are the people who use drugs. We as the people who use drugs understand our needs, challenges, and vulnerabilities better than anyone else. Our voices must be at the center of designing, implementing, and evaluating harm reduction programs. In Kenya and progressively in Africa, we have made some strides in recognizing the importance of community involvement. I am proud to have been the first person also who used drugs to sit at the Global Fund country coordinating mechanism of Kenya. And we have the same case in Burundi. We have the same case in different parts of Africa, but progressively we are heading there. This was a significant step forward, giving us a seat at the table where decisions are made about funding and policies. Unfortunately, we don't have that funding, but we are seated there. However, despite these gains, we continue to encounter significant challenges. Stigma and discrimination remain pervasive, hindering access to essential services, which perpetuate a cycle of marginalization. Punitive laws and law enforcement practices drive people underground, make it even harder to reach them with harm reduction services. In Africa, the situation is more complex. Many countries lack comprehensive harm reduction policies and programs. To overcome these challenges, we need to radical shift in approach. We need to move away from criminalization towards decriminalization and responsible regulation. And I think Zaved has really articulated that. We need to invest in community-led harm reduction program that is evidence-based, culturally appropriate, and tailored to specific needs of the people who use drugs. We need to empower the people who use drugs to become advocates for their own health and well-being. This means providing us with resources, training, and support we need to participate meaningful in decision-making process. Here are my few recommendation and our recommendation. I don't want to share a shopping list, but one, let us prioritize funding to the community-led harm reduction. Let us see the importance of funding community beyond extensive paperwork and polished proposals, because we have the community at heart. Let us decriminalize the effort of drug use. I think that is something that it need no argument, because the war on drugs since the first in 1914 by Harrison Anslinger has not done anything. It has caused us more harm than good. We need also to foster collaborations between governments, civil society organizations, and the people who use drugs. Therefore, this will ensure that harm reduction programs are effective, sustainable, and responsive to the needs of the community. The time for action is now. We cannot afford to continue down the path of punitive drug policies that have failed to reduce drug use and have caused immense suffering to us as the people who use drugs. Let's embrace new vision of drug policy, one that is based in compassion, respect, and the recognition that the people who use drugs are human beings who deserve the same rights and opportunity as everyone else. I thank you.
Thank you, Ahmed. Our final speaker is Marie Nugier, Head of Research and Communications at the International Drug Policy Consortium. You have the floor, Marie.
Thank you very much, Ambassador. Excellencies, dear colleagues, thank you so much for being here today. I would like to start by thanking all the co-organizers for this event, and in particular Colombia, without whom it wouldn't have been possible to be here today. As the ambassador said, I'm here representing IDPC. We're a global network of over 190 NGOs that come together to promote drug policy reforms grounded in health, human rights, and social justice. This side event is being organized in the context of the Support Don't Punish Global Day of Action. This is a day that is being celebrated every year on or around the 26th of June, which is also World Drugs Day. This year, communities have been gathering and mobilizing in more than 250 cities in 77 countries, all united under the common banner of solidarity of Support Don't Punish. Yesterday, many of you might have already seen, but the UNODC published their latest World Drug Report. And the data from this report is once again clear. Despite decades of investment in punitive drug control, demand and supply remain at record highs. In the meantime, civil society and the UN human rights system continue to document the devastating health and human rights impacts of punitive drug policies on millions of people in all corners of the world. In 2021 alone, we are told that over 450,000 people who use drugs lost their lives. These deaths are preventable with harm reduction interventions and with policies that would be grounded in care and support. And yet, the UN drug control bodies have so far been reluctant to propose meaningful reforms for a system that is currently clearly failing. That being said, the global drug control regime is now under unprecedented pressure, and a multidisciplinary panel of experts is now tasked with conducting an independent review of the system over the next 2 years. At the same time, there's no denying that the world is facing deep challenges, including a geopolitical crisis and a funding crisis that has already been mentioned by a few of the speakers for the UN as a whole, for harm reduction services, and for civil society. But all of this should be seen as an opportunity for change, for a shift towards what is most essential, to save lives, to protect health, to protect basic human rights, and to use the limited funds that are available for policies that have proven most effective. Positively, we're now finally seeing a shift across the UN system towards a new paradigm in drug policy. From IDPC's perspective, Geneva's contribution has been absolutely fundamental for this change of course. For decades, drug policies were built in complete isolation from human rights, with Geneva and Vienna operating in silos. This has resulted in policies that have been mostly reliant on punishment and repression. It's encouraging to see that these silos are finally breaking. And the Human Rights Council has been the motor behind this change. The 3 Human Rights Council resolutions on the human rights implications of drug policy have created the political space for member states to have a discussion on the human rights implications of drug policy. And that has resulted in a change of perspective that has greatly influenced the political discourse in Vienna and in New York, in particular on harm reduction. Importantly, these resolutions have enabled increased engagement by the Office of the High Commissioner for Human Rights. The office and the leadership of the High Commissioner have been a driver for the changes that we are now witnessing in Vienna. The OHCHR has taken on work that no other UN agency is doing by documenting and developing normative guidance on the intersection between human rights and drug policy. At the national level, OHCHR has helped to open new spaces of discussion and dialogue with local authorities, and it's also provided invaluable support for civil society and affected communities. Human rights mechanisms have also shifted their attention towards drug policy issues. The Committee on Economic, Social and Cultural Rights has been particularly active in promoting both harm reduction and decriminalization in its concluding observations, and is currently drafting the first ever general comment on drug policy. Special procedures have also been increasingly active in documenting drug-related issues, in particular the UN Special Rapporteur on the right to health and the UN Working Group on Arbitrary Detention. And yesterday, in case you haven't seen it yet, 20 special procedure mandate holders issued a joint statement at the occasion of World Drugs Day, once again calling for a shift away from the war on drugs. Let me end here with one recommendation. We urge member states to introduce a new Human Rights Council resolution on the human rights implications of drug policy. This is important because the drugs resolution is one of only a handful of resolutions that are not brought to the attention of the Council periodically. So far, they have only been tabled to feed into international processes that take place in Vienna and New York. And this inevitably limits their impacts, but also it means that the level of knowledge and expertise amongst delegations in Geneva on drug policy remains limited. Now is the time to assert the independent role of the Human Rights Council by recognizing that drug policy is a human rights issue. A recurring resolution would ensure that the Council is engaged in drug policy in the long term. It would consolidate human rights language around drug policy issues. And crucially, it would provide the OHCHR with a mandate to produce thematic reports on specific human rights impacts of drug policy, which are particularly relevant to the Council. We know that drug policy can be a polarizing issue, but these reports do not have to be polarizing. They're simply an opportunity for OHCHR to review available evidence, best practice, and present guidance on how best to address the human rights implications of drug policy. We're also acutely aware that the UN is in the midst of a serious financial and liquidity crisis, and efficiency is paramount in this context, but efficiently does not mean inaction. And importantly, a reporting request for OHCHR on the human rights implications of drug policy fills a critical gap because no other entity, either in Vienna or Geneva, is monitoring or reporting regularly on drug policy and human rights. I'm going to stop here. Thank you so much for your attention and looking forward to your questions and comments.
Thank you, Marie. And let me welcome and thank the presence of the Ambassador of Greece and the Ambassador of Singapore present at this meeting. The Ambassador of Singapore has asked for the floor. You have the floor, Excellency.
Thank you very much, Excellency, and I appreciate this very important event and the leadership that you show. I'm Singapore's ambassador to the UN in Geneva and Vienna, so I break the silo down because I cover both sides. I want to just use this opportunity, and I've heard very closely the important arguments made by the distinguished panel. Let me make just 3 points with questions for each of these points for the panel. My first point is, let's try to have a balanced approach to the issue at hand. And my sense is when we say support, don't punish, we should try to have an and both approach rather than an either or approach. We can support and punish and rehabilitate, if you like to put it that way, but to just say support and punish and make it appear like they're just two choices is maybe too Manichaean. My second point is a one-size-fits-all approach doesn't necessarily work. And Mr. Said used a very important language when he talked about a people-centered approach. And this culturally appropriate evidence-based approach and people-centered is very important. And that's something countries that are blamed for punitive approaches do. It's a serious approach to make sure we don't have a one-size-fits-all, because each country has its own context. That's very, very crucial to say. And I should say on this note, the World Drug Report that we just had issued 2025 talks about the preventing drug use, especially among young people. Let's not forget that. So we know the history of harm reduction from Merseyside in 1990 to the International Conference in Liverpool. We know that the history of this approach, but the prevention of drug use among the young is also very important. Now, before I end on my last point, we talk about decriminalization, and WHO has mentioned the UN Common Position, which is not the position of the member states. That's very important to know. Let's see what happened in my region in Thailand. We just had an effort to decriminalize with quick legislation, and just in the last 48 hours, Thailand has recriminalized the use of cannabis. So we must again adopt not a one-size-fits-all either or, but a very context-specific. What is good for each country? Colombia went through a devastating impact of the war on terrorism, war on drugs, and we respect their right to sort of take a different approach. But we should always have respect for every country's approach and not push. And it's important that OHCHR, that reports to the membership as part of the Secretariat, also should not push a particular approach, but take what the member states as a whole state. The death penalty was mentioned. There is no universal consensus for or against use of the death penalty in the UN. There isn't. And when it comes to most serious crimes, there is no international legal definition. So I think, again, this might be opinions of UN Secretariat or the OHCHR or common position, but it's not that of the member states. That's very crucial. And finally, and thank you very much for your indulgence, Mr. Chair. Evidence-based approach is very important, breaking down the silos. But what I worry about in this context of UNAT, there are already 3 bodies in the UN system dealing exclusively with the drug problem: UNODC, CNB, INCB. I think there's always room. High Commissioner Volker Turk, I've met him in Vienna twice or thrice. He comes and puts the view on the human rights side. I think there's room with the experts panel that Colombia set up for us to discuss these issues in the experts panel. But to start creating another body, create new mandates in the HRC, it doesn't mean that we don't do anything. We already have the right body in the UNODC in Vienna. But if we start spreading our resources too thin, we're going to have a problem. And we have a serious problem of human rights. People are dying, whether it's in Gaza or in Sudan or in Myanmar or other areas which the High Commissioner has shown leadership. Let's be very careful with how we use resources provided by member states and others. Thank you very much.
Thank you. Thank you, Ambassador. The Ambassador of Greece has asked for the floor. You have the floor, Excellency.
Thank you, Ambassador, and I will very briefly take the floor just to thank you, salute the initiative to organize the side event. I would like to reiterate my country's full support to the spirit of today's side event, which is that we need to enhance support. It's not an either-or choice, but we do need to support and to work together to find new ways to address a problem which has caused so much suffering, so much economic damage, so many societal problems, and many of these are linked to the wrong approaches we have used in the past. So we need new approaches, and Greece is ready to support initiatives that will find the right way forward. Thank you.
Thank you, Ambassador. And let me say that Greece has supported the event, as well as Portugal, Switzerland, Mexico, and my own country. Thank you very much. Please, Panama.
Thank you so much, Ambassador, and thank you so much to the organizers for having this round of presentations, and all the panelists for your very good insights from your different perspective. Panama has been a traditional co-sponsor of the draft resolution on drugs that have been presented in the Human Rights Council, and we have done that because we know that we need to break the silos, and we need to integrate a human rights-based approach when we address the issue and the world problem of drugs. And I think that the evidence that have been presented by different human rights mechanisms, including treaty bodies, special procedures, has shown that we need to move into a paradigm shift. And while we understand that there's no one size fits for all, we cannot we cannot forget that we have human rights obligations, and we need to respect those obligations while applying this drug policy, because at the end, those that are from the marginalized groups are the ones that have suffered the most. And that's what has been shown in these reports. We think that it is important to ensure that this topic keeps in the agenda of the Human Rights Council with certain periodicity. So we will be supportive to have a resolution presented in the future to ensure this. And while we have heard several times the concerns about the liquidity crisis, bringing the topic of the Human Rights Council that are being addressed in other bodies, and we want to ensure that there's a coherence within the UN system. And there's no other UN body that could provide human rights expertise than the Human Rights Council. And if that would be the argument, then the Human Rights Council will not speak about development, because there are other bodies that are specialized on development. We will not be discussing issues related to health, because that's why we have the WHO and so on and so forth, just to put an example. So let's discuss this in the future with open mind and in a very constructive spirit, and you can count on Panama's support throughout that process. Thank you.
Thank you. Thank you very much. Is there, please, Annette.
Thank you. Thank you very much. I think I just need to respond to the ambassador of Singapore. I hope it was clear that our technical guidance from 2014 and then several other guidelines already stated the need for countries to review and revise their punitive laws and legislation and work towards decriminalization of use and possession for personal use. So that has been in our guidance for, well, over a decade. And I just mentioned the UN common position. I know it's not a member state supported document, but it's 31 UN agencies that have come up with agreed language, a lot of which I think is reflected in the presentations here, around a focus on public health, around a focus on human rights, evidence-based, etc. So just wanted to clarify that. Thank you.
Thank you. Thank you so much for all your comments. Thank you very much for being here today. I think the idea of this side event is to create that space for conversation. So I'm really grateful for you to be here and to have made this intervention in a space that seems to be quite, you know, focused on harm reduction. So it's particularly useful to have your intervention here. Just a couple of thoughts in terms of support and punish. There is overwhelming evidence that shows that criminalization of people who use drugs and punishment does not curb drug use, but it does create stigma. It does deter people from accessing life-saving services, and it does create discriminations of all kinds. So that's why we have this slogan, support, don't punish, because for us, the decriminalization of people who use drugs is, as mentioned by WHO, critical enabler to access the services and the basic human rights of people who use drugs. In terms of culturally appropriate approaches, I agree with you. It's incredibly important to adapt policies and programs to the cultural specificities of each country. However, there are some basic principles and human rights that are at the core of the United Nations that we all abide by. And when you look at IDPC's network, what's interesting is that we have members from basically every region of the world, and we all agree on the basics of protecting rights, of protecting health. And we can only do this by removing criminal sanctions for people who use drugs and adopting services that are a continuum of care. Absolutely, prevention, evidence-based prevention is absolutely key. Harm reduction is absolutely key. Treatment is incredibly important. We see that women continue to be completely underserved in terms of access to treatment. So how can we ensure that the resources that we have available can actually be used to the best of our ability, and access to services remains absolutely key right now. Thank you.
Thank you very much. I don't see any. Oh, please. Yes.
Yeah, sorry. I think let me make it a little bit clear and practical. At some point when we are talking about decriminalization of drug use, we might not be very fair when we see at whether as the people who use drugs, we need to decriminalization as people who use drugs. But in mind also, we need also to put that these drugs just don't exist. They exist from our natural resources. And practically when you look at global South, let's say Colombia, let's say in Africa, in rural Guinea, where there are natural resources that raise like cannabis, coca in Colombia and all that. And recently, for those of us who happen to be in Colombia, we saw there are important need beyond what people understand about the grown of these plants. There is important need. There is evidence that has shown in Brazil, in Colombia, in some part of rural Guinea, that when we follow our culture based on appreciating our natural resources, we are not only making it easier for the people who use drugs, but we are also having an empowerment to our own economy. Drug use or drug war has been a form of control, colonialism legacy that controls other entities not to appreciate their natural well-being. So when we say culturally, we may mean moral imperative, but at the same time, we mean people, member state now to start sensitize our government, the importance of these plants in our countries. Thank you, and over.
Thank you. Thank you, Ahmed. Elizabeth, you have the floor.
Thank you, Ambassador, and also thanks to everyone for your contribution and discussion. I would like to elaborate a little bit on the issue of prevention, which I already mentioned in my presentation, particularly targeting the youth. That aspect is really important. In our 2023 report, as well as 2018 and 2015 report, we highlighted this issue, the addressing the youth. We see that more young people are using more drugs compared to previous generation. Youth population are vulnerable to drug use, and young people are severely affected by that. However, also we have seen that education, harm reduction, treatment services for young people are lacking. It is important to highlight that one. In our report, very briefly, I would like to highlight the 5 action points we mentioned. I'd like to read out from the 2023 report. First, we recommended measures to give children and adolescents information on the harmful effect of drug use, life skill education on preventing substance abuse, protocol for early identification and adequate referral of adolescents requiring treatment, accessible and youth-friendly drug dependence treatment and harm reduction services, quality rehabilitation service, and legal assistance for young people affected on drug charges, and as well as harm reduction education. All these needed to in the prevention effort targeting the youth and children and adolescents. Thank you.
Thank you, Sabet. Thank you very much. Well, thank you to you all for this important discussion and exchange of views. We have listened to very important interventions about harm reduction, about the failure of the war on drugs, about problems, health problems related to drug uses like hepatitis C, and the importance of empowering the people who use drugs, and the importance of taking into account human rights as a key factor in drug policies, and the importance also of respecting national approaches and the commitment with the efforts for finding a new policy on drugs respectful of human rights and more effective for the rights of all the people. Thank you very much for the representatives of Panama, Greece, and Singapore, and for our panelists, Dr. Mofokeng, Saved, Annette, Ahmed, and Mary, and to you all. Thank you very much.